Okay, welcome everyone. It is 12:16, so we'll go ahead and get started, but I know others will be joining us in the coming minutes. Welcome to the spring semester. Obviously, those of you here in Madison are under a new foot of snow, so it's very spring-like as always. And we have a fabulous list of speakers this semester. We're incredibly lucky to start off today with Professor Lucie Schmidt. Before we do, I'm going to turn it over to Marcy, who's going to give us a couple of words of welcome.
Great, thanks Jenna, and hello everyone. It's so nice to see you all on this very snowy day, and although we can't be together in person, it's really great to be able to gather virtually, and we've got a terrific lineup of speakers planned for this spring, including several international scholars that we would otherwise have a hard time getting to travel to Madison. So one silver lining is to be able to see people that we can see virtually. Easier. So despite this time of being physically separated, there's a lot happening at CDE. And hopefully you saw the recent CDE newsletter highlighting the addition this year of 9 new faculty affiliates, 11 new students in our training program jointly run by CDHA, many awards and honors, new grants, research activities, and really the ongoing productivity of CDE affiliates publishing more than 100 papers in 2020. So you all are a very productive bunch. So this spring, several CDE working groups will be active, including the Inequality Group and the Fertility, Families, and Households Group. So keep an eye out for those announcements, as well as the call for the second round of the CDE Seed Grant competition. So just to say welcome, everyone, and many thanks to Lucie for kicking off our spring 2021 seminar series. So I'll turn it back to you, Jenna. Thanks so much.
Thank you, Marcy. So today we get to hear from Dr. Lucie Schmidt. She is the John J. Gibson Professor of Economics at Williams College. Dr. Schmidt works on health economics and economics of the family, labor economics, a really broad range of topics that a lot intersect with public policy, a focus on the safety net. Personally, a really interesting set of papers related to infertility and people's ability to access services related to infertility, but just a tiny drop in what is a very large research portfolio that spans a lot of interests of shared with people here in CDE. Dr. Schmidt is also the co-editor of the Review of Economics in the Household. And today we get to hear about her work on evidence from the ACA Medicaid expansion. You are welcome to ask questions during this seminar, so you can either unmute yourself or feel free to post your question in the chat and one of us will ask it. And otherwise you can save questions to the end, but Dr. Schmidt says it is fine to interrupt her as she goes. So I will turn it over to you. Thank you so much for joining us.
Great. Thank you all so much for having me. I'm very sad that I'm not in snowy Madison at the moment, but I'm really excited for the opportunity to present this research to you. So today I'm going to be talking about the Medicaid expansion that was part of the Affordable Care Act. As everyone, I think, in this group probably knows, there's been a cottage industry of ACA Medicaid expansion papers. And this is joint work with 2 of my Williams colleagues, Lara Shore-Shepherd and Tara Watson. And what we're going to be talking about is the possible spillover effects that the Medicaid expansion might have had on participation in other safety net programs. Okay. So just to give some motivation, the US safety net is really a patchwork of programs. So there are many public programs. They have interactions in very complex ways, and they serve a potentially overlapping set of beneficiaries. So one of these programs, the program Medicaid, that provides public health insurance for low-income individuals, was expanded in a great way by the Affordable Care Act in 2010. So given the connections across programs, we think that this change might have had spillover effects to other forms of public assistance. So the question we're going to be asking in this paper is, how did the ACA expansion of public health insurance affect participation in 2 major safety net programs, and 2 of the biggest and most important safety net programs in the United States, the Earned Income Tax Credit, or EITC, the Supplemental Nutrition Assistance Program, or SNAP, formerly food stamps. So if we want to think a little bit, I'll get into this in more detail in a few slides for the specific programs. But in general terms, if we wanted to think a little bit about how expanded eligibility for Medicaid might affect participation in these programs, one possibility is that mechanisms work through changes in earnings. So these new Medicaid limits could affect eligibility for EITC and SNAP through changes in earnings. So you could have a situation where individuals are reducing their income to below the Medicaid limit to qualify, which might increase eligibility for EITC and SNAP. On the other hand, these higher limits could also allow individuals to enter the labor market or earn more and still qualify for Medicaid, potentially changing eligibility. In addition to these changes that work through labor supply, it's also possible that expanding Medicaid could have informational effects. It could draw individuals' attention to other programs. It could reduce the transaction costs of enrolling in other programs. This is particularly true if you thought that the offices where people might sign up for Medicaid might provide information for individuals for other programs. So like many of the other papers that look at the ACA Medicaid expansion, we're going to exploit the Supreme Court decision that made the Medicaid expansion optional for the states. Unlike most of this literature, however, we're going to use a slightly different approach than the straight difference in difference. So we're going to adopt a research design that's been used in the minimum wage literature, where we're going to look at county border pairs. So the idea here is to examine EITC and SNAP participation in contiguous county pairs that cross state borders, where one state takes up the Medicaid expansion and the other did not. And we're going to argue that this allows us to better control for local economic trends that might affect safety net participation. So I know some people have to leave early, so just a quick preview of our findings. We're going to use county level administrative data, and our findings from those data suggest that the Medicaid expansion significantly increased participation in SNAP, had a slight positive effect on EITC returns, but not statistically significant. We're then going to turn to data from the ACS, the American Community Survey, both to corroborate our findings from the county level data, to examine heterogeneity across groups, and then to explore mechanisms. And our ACS results, which are really consistent with our county level results, suggest that the safety net impacts that we see are primarily due to the eligible population being more likely to participate rather than increased eligibility due to labor supply responses. Okay, so I'm just going to go through the programs and give a really brief overview, given that I am guessing that many people in the group are well familiar with these programs. Medicaid provides public health insurance for low-income individuals in the US. It's an extremely, we spend a lot of money on Medicaid, $580 billion in 2016, 1 out of every 6 health dollars. Medicaid is a partnership between the federal government and the state government. The federal government provides funds and states operate within a set of federal guidelines. So prior to the ACA, Medicaid eligibility was really categorical. There were certain groups who were covered with varying income limits by state. Children were generally covered. Parents were often covered, but at lower income limits than those for children, individuals with disabilities, and the elderly. So what the ACA wanted to do as part of the broad goals to expand insurance coverage and to reduce the number of uninsured in the US was to expand Medicaid to everyone who had income below 138% of the federal poverty line. In 2012, the Supreme Court ruled this Medicaid expansion could not be forced upon the states. It made it optional to the states. All but 12 states have eventually adopted this. And I'm going to show this map, and I'm going to show it again in a few more slides. So this shows the current status of the Medicaid expansion decisions as of 2016. There's a few states that have changed since then. And all I want you to take away from this graph at this point, I think, is that the set of states that did not take up the Medicaid expansion, those are shown in orange, is not a randomly selected set of states, right? So we just might be a little concerned in terms of thinking about looking at the Medicaid expansion in a straight diff and diff framework. So in terms of previous literature on these spillover effects, there's really not much work that we are aware of. So Kate Baker and her co-authors in 2014 look at the Oregon Medicaid experiment, which basically had a lottery and gave some individuals, based on this lottery, access to Medicaid. So they look at some spillover effects. They find no evidence of a relationship between receiving Medicaid and participation in TANF, and temporary assistance for needy families, but they find small positive effects on SNAP participation. And then there's a paper by Bernie, Boehm, and Lopez in 2018 that's a state diff and diff, and they find small positive effects of the Medicaid expansion on SNAP. So if we think about the Earned Income Tax Credit, this is the largest cash assistance program for the non-elderly. In 2013, we had 26 million recipients and $63 billion in spending. The EITC is refundable. People basically, instead of getting a monthly payment, get the EITC when they get their tax refund, usually in February or March. There are separate complicated EITC benefit schedules by both filing status and the number of dependents. And take-up rates for the EITC are pretty high, between 75 and 79%. One thing I do want to just point out when I talk about those take-up rates is even though they are high in terms of being a public assistance program, they are significantly less than 100%, which does suggest that there might be some room for movement along take-up rates in terms of if we provide more information, we could have people that are taking up benefits. So if we want to think a little bit about the mechanisms by which the Medicaid expansion could affect EITC returns, changes in labor supply, either on the extensive margin of going into work or the intensive margin of the number of hours, might affect eligibility for the EITC, depending on the relationship between the Medicaid income limit and the EITC schedule. So I'm going to kind of go back and forth between this slide and my EITC income tax credit schedule. So this is the schedule for unmarried individuals, so single filers or head of household filers who have children. And what I can show you is we have the EITC schedule for each group, showing the phase-in range as the benefit increases with earnings, the flat range, and the phase-out range. And on the horizontal axis here, we have household income. So you can sort of see where the EITC phases out for families with 3 or more children, with 2 children, with 1 child, and with 0 children. In addition, what we've put on this graph is the income level that goes along with the Medicaid cutoff of 138% of the federal poverty line. So this is for a family with 3 children, with 2 children, with 1 child, and with no children. So for parents, we think that the effects that we are likely to see are due to labor force entry. Before the ACA, parents could obtain Medicaid, but the income limits were really, really low in most states. So as a result, you could have had parents who stayed out of the labor force so that they could have health insurance. Post the Affordable Care Act, they could enter the labor force and their new earnings under 138% of the federal poverty line would make them eligible for the EITC. But if we go back to this chart, given the relationship between the ACA income limits and the phase-out range, it's unlikely that we would see labor supply reductions for parents. So if you imagined that individuals were reducing labor supply to be eligible for Medicaid, in most of these cases for parents, the 138% of the federal poverty limit is sort of nicely within the EITC range. So if you reduced your labor supply, it's unlikely to make you newly eligible for the EITC. For non-parents, we think that the effects, if we were going to see any due to labor supply, would be instead due to reduction in hours. Before the Affordable Care Act, non-parents were not eligible for Medicaid, so we shouldn't really see any effects on labor force entry. But the EITC benefits for non-parents phase out to 0 below the Medicaid eligibility cutoff. So that's this group right here. So you could imagine someone reducing labor supply to qualify for Medicaid and that putting them into EITC eligibility. So those are the pieces that would work through labor supply. Separate from that is the idea that there might be information or sort of nudges that go along with Medicaid eligibility. So we think that workers who have low incomes who might not have previously filed tax returns might learn about the EITC or might be nudged to file when they enroll in Medicaid. For SNAP, which is formerly known as food stamps, again, it's another large social safety net program, about 40 million recipients, $57 billion in 2018. Households are eligible if their income is below 130% of the federal poverty line. So not exactly the same cutoff for Medicaid, but very, very close. Take-up rates, again, are in the range of about 75%. And in terms of thinking about eligibility, there are not really categorical eligibility requirements, but there are time limits for some group. So non-working, non-disabled adults, 49 and under, without children. These are often referred to in the literature as ABODs, the able-bodied adults without dependents, have a time limit for benefits. So limited to 3 months of benefits in a 3-year period, except when there's a time limit waiver. So for the time period we're looking at, the stimulus package that went along with the Great Recession waived these time limits in all states, and then different states and different counties sort of brought those time limits back at different times over our sample. So we'll do some analyses where we control for that to see if that affects our results. In terms of thinking about mechanisms, again, for the Medicaid expansion to affect SNAP receipt, if people are reducing their labor supply in response to the Medicaid expansions, we would expect that that would increase eligibility for SNAP. It's possible that labor supply might increase for those who were previously Medicaid eligible at lower income limits, and that would reduce SNAP participation, but that would be this really like precise change somewhere between 130 and 138% of the federal poverty line. So we think that's pretty unlikely. And then finally, Medicaid enrollment could lead to information about programs, reductions in the marginal costs of applying. You could imagine a welfare office that is providing information about all of the programs that individuals might be eligible for. And Amy Finkelstein has work that suggests that information can actually lead to increased SNAP participation. Okay, so we're going to use 2 different types of data in this project. We're going to use county level annual data from 2010 to 2016 from a number of different sources. So we're going to confirm that our approach shows similar effects on health insurance to the previous literature. So we'll use the census small area health insurance estimates. For EITC, we're going to use IRS statistics of income data. These are the number of tax returns for a given year, the number of EITC returns for a given year. We have information on the number of SNAP participants by county. The food stamps, the USDA only reports SNAP participants by county for a subset of states. So our SNAP sample is going to be slightly different than our EITC sample. And I'll come back to that in a few slides. We're going to use census population to denominate our key variables of interest, the EITC returns and the SNAP participants. We're also going to use them to generate estimates of population in terms of the percent non-Hispanic Black and the percent Hispanic in the counties. And then finally, we're going to use Bureau of Labor Statistics data for unemployment rates. So one advantage of the county level data is these are actual counts of EITC returns and counts of SNAP participants. That's really beneficial because we know from work by Bruce Meyer and others that a lot of survey data have significant underreporting of program participation. That said, with the county level analysis, it limits what we can do. So we're going to move to the American Community Survey data. We're going to use that from 2011 to 2017, and that will allow us to bring in individual level data on demographics, So we'll be able to both look at heterogeneity across groups. It will allow us to look directly at labor supply to try to figure out mechanisms for any effects we might find in the county level data. And then we'll be able to also sort of confirm our estimates on program participation. Okay, so we're gonna have many of the ACA papers are sort of a 0-1 variable in terms of looking at whether the state expanded or did not expand Medicaid. We're going to use more variation than that. So states had different income eligibility limits for the Medicaid before the ACA. As a result, that meant that the ACA change was bigger in some states than it was in others. So we're going to use the continuous measure of income eligibility as a percent of the federal poverty line. We're also going to look both at states that expanded early, some states expanded later, many of the states expanded in January 2014, and some never expanded. Okay, so the typical approach to studying the Medicaid expansion is a state difference in difference analysis. The treatment states expand, the control states don't. Researchers compare changes in their outcomes of interest in the expansion states to changes in the outcomes in the non-expansion states. And the key assumption is that if the treatment hadn't occurred, we'd see parallel trends, right? That EITC and SNAP participation would sort of be evolving in the same way between the two sets of states over time. But again, I think that looking at the map of the states that expanded versus the states that don't, there are some real differences in which types of states expanded and which types of states didn't. It's pretty clear that many of the states that had high rates of uninsurance to begin with did not expand. So what we're going to do is a slightly different approach. So we're going to use these county border pair differences. And we've used this approach in work. So the Schmidt, Shore, Shepherd, and Watson 2020 reference is looking at the effects of the Medicaid expansion on disability benefit applications, so looking at applications for supplemental security income and Social Security disability income. And in that paper, which came out last year in the American Journal of Health Economics, we basically show that there is a pretty precisely estimated 0 effect of the Medicaid expansion on disability applications. So our approach here is really going to be to look at these county border pairs that are straddling state lines where one state took up the Medicaid expansion and the other state didn't. So this graph sort of gives you an illustration, although there's much more variation in terms of the limits that we're exploiting than it shows up in this graph, because we're looking at more changes than just the 2014 changes. In California, you had county variation in when different counties were taking up the expansion. So we actually use some of the within variation within the state of California. And in the paper, we have sort of a detailed chart of all of the variation in pairs that we're using. So we are going to argue, and I'm going to try to convince you that the county border pairs make a better research design for looking at this. We think that the county border pairs are more likely to share common labor markets. They're more likely to share macroeconomic shocks and trends. One concern with this approach is maybe there's migration across state borders in response to the ACA. Work by Goodman suggests that that really doesn't look like it's the case. I can show you that before the ACA, that outcomes, differences in outcomes are smaller for contiguous pairs of counties than they are for all pairs of counties. So this is our EITC sample. It shows the number of EITC returns, the unemployment rate, the percent in poverty, and some measures of difference in terms of demographics. And what you can see here just is that the difference between counties, between all pairs of counties and contiguous pairs of counties, the contiguous pairs are much closer in terms of these key variables than the set of all pairs. So our key assumption in our analysis is we're basically saying that if the treatment didn't occur, the Medicaid expansion, outcomes within each pair of bordering counties would have changed or evolved in the same way. So our empirical approach, we're going to estimate two different specifications. So the first specification here, our key variable of interest is the non-categorical Medicaid income limit. We're going to regress our outcomes on some control variables, on a set of county fixed effects, and a set of year fixed effects. So the first specification here you can think of as being analogous to the straight difference in difference, except for that we're estimating it on the sample of all counties instead of the sample of states. So our data are at the county level, not at the state level. The second specification that I show here is our preferred specification. And you can see here that instead of having, we still have county fixed effects. Instead of having straight year fixed effects, we have fixed effects that are specific to a county pair and year. Okay, and what that is basically saying that all of our variation is coming from county pairs where you have variation in the income limit between the county pairs that sort of changes over the time period that we're looking at. So one thing that's clear here is that I'm estimating the first one on the sample of all counties. I'm estimating the second one on the sample of border counties. So there's some concern that what I might be finding with our preferred specification is just a difference in sample. So I'm going to run an intermediate set of regressions where we do the straight county diff and diff on the subsample of border counties. So you can see sort of what happens just from moving to that sample of border counties. In terms of thinking about whether the effects seem to change, we're going to lose some precision when we do that. So to do this, there's some interesting data restructuring that has to go on. So each observation in our data ends up being a county pair, and a year. So you can imagine if county A is bordering two different counties, counties B and C, then we have one observation that's county A and pair AB for the year 2010. And then we have county B, pair AB 2010. And then we have county A, pair AC 2010, and so on. So this actually took a little bit of work in terms of both figuring out how to weight appropriately and how to adjust the standard errors appropriately to account for this fact that we have county years in multiple pairs. So, all right, so before I estimate the regressions that I showed you, I want to do a graphical descriptive exercise that I think gives you the flavor of what we're trying to do here and really shows the difference between the diff and diff and the county pairs approach. So for this simple descriptive exercise, we're going to break counties into two groups, those that ever expanded Medicaid and those that did not. So I'm collapsing all of the variation that I just told you we were going to use in the regressions into a binary ever expanded Medicaid and not really look at the variation over time in terms of when states expanded Medicaid. So what we're going to do then is controlling for the variables we control for in the regressions. We're going to regress outcomes on the interaction of this ever expanded dummy with dummies for each year. And what I'm going to show you are the point estimates and confidence intervals for the standard diff and diff model for all counties, the diff and diff model on our sample of border counties, and then our preferred specification controlling for the border pair year effects. So this just shows our key dependent variable of interest here, the non-categorical Medicaid income limit. And what you see here is the empty triangles are the all county diff and diff. The solid triangles are the diff and diff on the contiguous county sample. And then the solid circles are our border pair analysis. And for the Medicaid income limit itself, right, these look very, very similar across the groups. We're not seeing much variation there. But if we look at the effect on the percent uninsured, we see a slightly different pattern. So in the years before the Medicaid expansion takes place, so 2011, 2012, and 2013, all three specifications are showing effects pretty close to zero. Once 2014 hits, we can see the effect of the Medicaid expansion in terms of reducing the percent uninsured. But one thing you can see here is that actually the border pair approach, which is the solid dots, isolate the impact of the expansion much better than the diff and diff. And that has to do with the fact that the states that are expanding are just very different than the states that aren't expanding. So we're getting better variation from that county border pair group. Okay, so if we look at EITC filings, what we see here is looking at the diff and diff, it looks like EITC filings are higher significantly before the expansion hits in 2014 in the diff and diff approach, right? So you can see the triangles here seem to show that there's these pre-trends in EITC filings that are happening, that are showing up in the diff and diff that are not showing up in our county border pair approach. And after the expansion starts in 2014, again, you can see that our border pair estimates are more conservative here than the straight diff and diff, which are showing positive and significant increases of EIT filings in response to the ACA Medicaid expansion. For SNAP, we get kind of a similar pattern. It seems like there's less of a pre-trend in SNAP participation rates. And the estimates are all relatively close to each other in terms of the three specifications. So at least from the county level data, it seems like the specification matters a little bit less. Although this is the county level data, and I will remind you that we don't have all states for the county level data. When we look at SNAP participation in the ACS, we sort of, again, see similar patterns, but it looks like there's more of an effect in our border pair approach than it is in the straight diff and diff. So this is really just to illustrate what we're doing. I'm going to now sort of dive in and show you our primary regression results.
Can I ask a question?
Yes, please.
Welcome.
Thank you.
So, to what extent should I think about the matched or the border pair design as being kind of a version of synthetic control analysis where you have a very strong prior about the weight, what the weight should be in the synthetic control?
Yeah, that's a really great question. And we've sort of gone back and forth about actually trying to do a synthetic control with this to see how close the estimates we would get from that would be to what we're doing here. I think the argument that we're making is that the county border pair is closer to the synthetic control, right? That it's getting us to sort of a better control group in terms of what's happening in the local labor market and the macro trends. I'm guessing that if we did a synthetic control, we would get closer, but conceptually, it definitely is along those same lines.
Yeah, I hadn't thought about it that way before. That's anyway,
Yeah,
I'll think about it more. Thank you.
Yeah, no, thank you. I think it's a great question. Are there other questions before I sort of dive into regression results?
You're going to talk about migration at some point?
So I'm only going to talk about migration in that other work has been done that suggests that the ACA did not lead to migration, but it's something we've been talking about testing directly ourselves. We have not tested it directly ourselves, and I think there is. I think it's a health affairs paper that shows that there's no migration, but I think we will be more confident in that when we've done the analysis ourselves.
Oh, of course.
So, any other questions before I move on? It's a little surreal to present when you can't see anyone's faces.
I look terrible, but I can turn my video on.
Hi, Jeff. How are you?
I'm all right. How are you?
I'm good. It's good to see you.
A lot of orange happening there in your house.
All right. So in terms of thinking about health insurance, the first thing that we wanted to do was just confirm that with the county pairs approach, we see similar effects on health insurance coverage to the previous literature, right? And one of the strongest findings from the ACA literature is that the Medicaid expansion led to more health insurance coverage, lower rates of uninsurance. So we wanted to know, can a similar increase be seen at the county level using the border county strategy? So for all of the regression results I'm going to show the 3 columns. So all counties is the straight diff and diff on the whole group of counties. Contiguous counties is the first contiguous counties column. The middle column is the straight diff and diff on the subsample of contiguous counties. And then the third column is our preferred specification that includes the county pair by year fixed effects. What you can see here is that, and this is really similar to the descriptive graph that I showed in a few minutes, if you look at the percent of low income uninsured, you get significant effects for all 3 specifications. They are larger when we look at the contiguous county sample. They're larger when we include the county pair by year fixed effects. So this is an effect of size of about 2.8 percentage points. Remember that we've entered the non-parent income limit in a continuous linear manner. So basically, if you think about that point estimate, the relevant comparison that you want to make in your head is if you're moving the income limit from 0, which is what it was before in states that didn't have a non-parent limit that was higher than 0, to 138% of the federal poverty line, that's going to reduce the rate of uninsurance by 3.8 percentage points. So it's about a 12% reduction in uninsurance relative to the baseline mean. So a large effect and very consistent with what the previous literature finds. If we look at EITC returns, we see that in the diff and diff, that implies that we have a positive and significant effect of the Medicaid expansion on EITC returns per 100 working age adults. When we restrict our sample to the county pair year approach, where we're identifying within these county pairs, the magnitude of the coefficient falls by about half, and it's no longer statistically significant. So it's not only not significant, it would be really small if we were thinking about the magnitude here. It would be about a 1% increase in terms of relative to the baseline. But we're really reading this as saying, like, once you better control for the differential trends, that there's not really an effect on EITC returns.
Question?
Yes.
Maybe a remark. So on the uninsured status, the standard errors went down when you added the county pair fixed effects, and for the EITC, they go up a little bit, which is interesting, right? Because they're picking up variance, but they're also sucking up degrees of freedom, right? And there's a little competition between those two.
Yes.
And the fact that for the uninsured they go down tells you that kind of that's worth doing, right? Implicitly, there's an F test in there somewhere.
Yeah.
And then the fact that they go up here, in addition to your, null finding, although the point estimate is not that small.
Yeah.
No, I would highlight the standard errors as well as the coefficients. I think that they're telling you something about the data.
That's a great point. Thank you. Yeah, we lose a lot of degrees of freedom with the county pair year fixed effects. These things take, especially when we get to the ACS, these things take a long time to run. So, all right. So if we look at SNAP, the results for SNAP are more consistent across the different specifications. In our preferred specification, we have a positive and significant effect of the Medicaid limit on SNAP participation. So moving the income limit from 0 to 138% of the poverty line would lead to about a 4% increase in SNAP relative to the baseline mean. So if we look at the county border pair analysis from our county level data, our interpretation of what we're finding is no significant effect of the expansion on EITC, a positive and significant increase in SNAP. The magnitudes of these would imply that about 30% of the people who were induced to get insurance from the Medicaid expansion were also induced to participate in SNAP. I can compare this with results from the Oregon experiment in terms of sort of the share of extra Medicaid recipients who moved to SNAP. So their estimates would actually suggest about 10% of those induced to participate in Medicaid by the lottery were induced to participate in SNAP. So our magnitude there of spillovers is quite a bit larger than what they find in the Oregon experiment. So these reflect net effects, right? So I had gone through all of the different mechanisms in terms of thinking about labor supply and thinking about information. What I'm getting from the county data is the net effect. So what we're going to do is we're going to look at both heterogeneity and mechanisms using individual level data in the American Community Survey. So we went through a long and drawn out process to try to get access to county level identifiers. Those have to be used in an RDC. We are in Williamstown, which is not close to any RDCs. And so we went through this long process to get access to the Yale RDC so we could use the county identifiers. We were approved for access in April 2020. So we have access, we cannot get into the RDC. So we've been in a bit of limbo in terms of this project, sort of weighing the costs and benefits of waiting to get into the RDC to use the county identifiers when we have actually no idea when that might be possible versus using what's available in the public version of the data, which are the PUMAs. So what I'm going to show you are the PUMAs. I would love feedback from folks on whether they think the PUMA results are compelling or whether we should really wait for the county identifiers before we take the plunge and submit this to a journal, because I just have no idea when that will happen. So what we're going to do is, rather than a county border pair design, we are going to implement a PUMA border pair design. Okay. So with our ACS analysis, we're going to look at a sample of individuals aged 25 to 64. And what we're going to do is estimate results for the full sample, as well as for demographic groups that are based on parental status. So our categories are a little quirky due to the quirky nature of EITC and SNAP rules. So we're first looking at married versus unmarried parents, and that's primarily due to the differing EITC rules by filing status, thinking about married filing status versus head of household filing status. For non-parents, we're going to break it up by age. So we're going to look at individuals who are 25 to 49 versus non-parents who are 50 and older, due to the different SNAP eligibility requirements by age. So remember, the ones who are under the age of 50 are the ABODs, so they're going to have time limits in some of the years that we're looking at. So we're going to control for demographic group, race and ethnicity interacted with demographic group, gender, education, age, and age squared. And what I want to do is look, again, sort of confirm the health insurance results. We're going to look at reported SNAP participation over the last 12 months. We can't identify EITC in the ACS, so we're going to look at EITC eligibility. But you should remember that the EITC eligibility is based entirely on sort of earnings as well as filing status. So there's not really new information there other than the labor supply measures that I'm going to show you, and then labor supply measures. So we'll start off with the health insurance results. Here I'm only showing you the PUMA border pair specification, the preferred. I'm not showing the straight diff and diff. So what you see here is strong, significant, consistent effects of the Medicaid expansion on the likelihood of having any health insurance across all 4 demographic groups that we look at. And those effects are larger for the subpopulation under 130% of the poverty line. So again, sort of consistent, strong effects of the Medicaid expansion on the likelihood that individuals have health insurance. We next look at safety net outcomes. So we looked at whether there was any SNAP in the household, that's the first row, positive and significant effects for all groups. They're stronger for any SNAP in the household if we're under 130% of the poverty line. And then really what we wanted to try to do was look directly at these spillovers by looking at sort of people who were jointly on SNAP and public health insurance. So the third row shows that we have a significant increase in all of these groups in the likelihood that someone is on both SNAP and public health insurance. And the row after that shows we have a significant decrease in the likelihood that someone is on SNAP but not public health insurance. So this, I think, is consistent with this idea that there are these spillover effects, that we're getting more people who are on both, and we're actually seeing a reduction in people who are just on SNAP and are not on Medicaid as well. The final row here, we can't look at temporary assistance for needy families in the county data because we don't have county level information on TANF caseloads, but we can look at that with the ACS. And what we find is some evidence here that there was a slight increase in TANF participation among single parents, and then a smaller one among married parents. So that, again, could be consistent with the idea that if you go to enroll in Medicaid, you get information that you might be eligible for some of these other programs. We've thought about trying to do more with this in terms of differences by state, because the likelihood that you get any help from TANF, I think, varies pretty dramatically across states, but we haven't really had a chance to do much with that yet. So we have the other thing I should say just before we do this is in the paper, so these just show the coefficients and the standard errors. In the paper, we actually also show false discovery rate Q values to try to take into account the fact that we're doing multiple hypothesis testing here. Almost everything in our safety net outcomes table is robust to using those Q values that are accounting for the number of tests that we're running. Once we start looking at the next table, which is Eitc eligibility and labor supply, most of these results actually don't hold up to the multiple hypothesis testing correction. So we find some suggestive evidence of an increase in Eitc eligibility, primarily for single parents, a little bit for older non-parents, which we don't have a good story for, but again, that doesn't persist past the multiple hypothesis corrections. And again, there's some suggestive evidence of some tiny labor supply effects. So it looks like single parents are slightly more likely to have any wages, slightly more likely to have any hours. It looks like there's a slight increase in older non-parents being under 130% of the poverty line. But again, these results, I think our entire sort of pattern of labor supply results are just not robust to a number of different tests. So our read of these results is that we are finding, again, these strong safety net participation effects in the ACS and very little evidence of labor supply effects. And that's really consistent with almost all of the previous work that's looked at the ACA and labor supply. There's very little evidence in the literature of labor supply effects of the ACA. So to summarize the ACS results, again, we find that the Medicaid expansions had positive impacts on the receipt of SNAP relative to bordering PUMAs. About 25% of the new non-parent Medicaid recipients were also induced to get SNAP. And our read of these results is that they don't appear to be driven by a labor supply response. So we think this suggests this role for the information or transaction costs. We do see some positive impacts on Eitc eligibility, but generally they're not statistically significant. So our read on that is that the effects on safety net are not explained by labor supply and therefore not really explained by changes in eligibility. So we've done a number of robustness tests. So we've looked, instead of using the continuous Medicaid expansion variable, we've switched to the binary expansion to be more consistent with the previous literature. Results are very similar. We've added controls, including things like the age composition of the population. We don't include the unemployment rate in our primary specification. We think it's probably a bad control in this context, but our results are all robust to including it. We control for variation across states and over time in the waivers for SNAP, able-bodied adults without dependents. That doesn't change our results. And like I said, we've done sort of these false discovery rate Q values to deal with the multiple hypothesis testing. So I will wrap up and then I'll have lots of time for questions. So in conclusion, we see these results as suggesting important spillovers across safety net programs. So about 25 to 30%, depending on which data we're using, of those gaining public insurance were induced to participate in SNAP. One thing that this means is that the federal government costs of the ACA and transfers to the expansion states were higher than just the Medicaid costs alone. But there's also the flip side of that is for states considering expansions, these additional inflows of SNAP dollars are an added benefit. I think there's also some implications here in terms of thinking about effects of the Medicaid expansion on well-being. So to the extent that we know that SNAP improves well-being of families, any effects we're finding of the Medicaid expansion on well-being, some of that is definitely working through health insurance, but some of that could also be working through higher SNAP participation. And it'd be really, really interesting to try to disentangle some of those effects. And finally, we think that the results might shed light on barriers to safety net take-up. It's pretty clear that for most of these safety net programs, we have significantly less than 100% take-up. It seems like receiving information about one program while you are signing up for another program could actually help improve safety net take-up. And I think this has sort of broader implications. I'm working on a new project now where we're looking, that's a little bit related. California in 2019 changed their policy to finally make SSI recipients eligible for food stamps. They had not been eligible for food stamps since SSI was started in the 1970s. So we're collecting data from counties in terms of what kinds of outreach they did to this new pool of eligible people. So trying again sort of to think about how information matters can help us, I think, figure out how to best serve low-income populations in terms of the safety net. Thank you.
Thank you for that fantastically clear talk. It was really a masterclass in making a paper accessible to a big group of people. Okay, so while everyone is thinking of some questions that they'd like to ask, I'm going to go ahead and get started with one, which is, it is really an interesting idea that you have this pretty big effect on SNAP take-up, and you focused here on individual level heterogeneity, but I'd be curious about place-based heterogeneity. Is it places that have pretty low take-up rates that you're moving the needle the most, or are there other, to the extent that we're trying to learn about how to improve take-up, is there other features of delivery across places that could be informative? I mean, and that that kind of heterogeneity maybe it's a little difficult to tease out from a causal perspective, but I'd be curious descriptively what you have to say about that.
Yeah, that's a really, really great question, and it's not something we have looked at. So I've just written that down, and I was gonna say I'm gonna run home, but I'm actually home. So when we're done with this, I'm gonna see what we can do on that, because I think you're right. Trying to understand not just the individual heterogeneity, but the extent to which sort of the characteristics of the local area could be determining sort of some of this movement would be really, especially in terms of going back to the last point I was trying to make in the conclusion, in terms of thinking about take-up and thinking about better serving low-income populations. I think that it's a really great point.
David, go ahead and unmute yourself.
Hi, thank you for this talk. I have a question about spillovers of outcomes between counties within a state. I think like the comparison of contiguous state or contiguous counties across states is a really neat idea. What I'm struggling with is whether there's any implications to your findings if there are spillovers between like maybe SNAP uptake or other social services, you know, for bordering states or for bordering counties that are within the states. Is your diff and diff design robust to that? Is there any bias implications? Is that part of the finding?
So I don't know if it was my internet connection, David, or your internet connection, but you glitched out a minute there. So can you repeat the part about which kinds of spillovers of outcomes you're thinking about?
So I'm thinking about spillovers of social services uptake, such as SNAP uptake, between counties that are within the same state. So they're contiguous, but they're not part of the contiguous pair that you're interested in. And I'm wondering if that has any implications for your identification strategy, or if it's robust against that, or if that's part of the finding.
Yeah, so I think if we're picking something like that up, we're only picking it up indirectly. So if you imagine this sort of, like I can imagine a scenario where you've got 3 counties kind of in a row, and the top 2 are sort of bordering a state, crossing a state border. And then there's an interior county that's sort of next to this other county. I think that's sort of what you're talking about, right? Not the borders, but contiguous counties sort of within the same state.
Correct.
So the non-contiguous, the non-border county is just not even in our sample. So to the extent that there's things going on there, we're not picking it up. We're really only picking up the effect across the border. I'd have to think a little bit about what I might expect would happen with those interior counties. We really have not thought much about them.
Okay, thank you.
Yeah, thank you.
Jeff, you want to ask a question?
Yeah. Should we think about these as short-run estimates or long-run estimates or some combination of the two? And given the institutional context, would we expect the short-run and the long-run effects to differ substantially?
Yeah, that's a really great question. I think we're oh gosh, where do I even start with this one? In the disability paper that we published last year, because disability programs are such an absorbing state, we thought a lot about this, and we had originally done that analysis with county level stocks of participants and decided that that was wrong because the flows seem to be really, really important, right? There's that Heider-Klerman paper on AFDC about stocks versus flows. I think that's even more important in the disability benefit context because there's such an absorbing state. I think that I would have preferred to have flows for this paper also. I would have preferred to have applications for SNAP as opposed to participation in SNAP. My sense is that, and this actually could be wrong. I don't know if I'm about to say something, this could be totally false, is that SNAP participation is not as persistent as participation in some other social welfare programs. I think that there's more turnover in SNAP. So I don't have a great answer to this question, Jeff, but I think it's something we should think more about. I don't know if you have thoughts on whether what I'm picking up here in terms of short run versus long run.
Well, I was wondering if there's I'm trying to think about the mechanism here, right? So I get sick, I'm a low skill person, I decide to try to sign up for Medicaid. in one state I'm not eligible, the other state I am, and I guess in the first state I could quit my job and be eligible. You know, it's that, and then I go down to the Medicaid office and maybe they do or do not tell me about SNAP. And if that's the mechanism, then it seems like the long run effect could be bigger. I agree with you about the churn. Certainly it's higher than DI. Everything has higher churn than DI. But the long run effect could be larger than the short run effect if it's sort of an accretion effect of people coming into the office and learning about food stamps when they get sick.
Yeah, no, I think that's right. And then the other thing that I'm not picking up at all would be, you know, I think there's some evidence, again, more so from the disability literature, but some from the AFDC literature about peer effects and information about social programs. So if I'm in a community and, you know, my friend over here becomes, you know, goes on Medicaid and they learn about SNAP, then maybe I learn about SNAP, sort of related. So it's possible that, you know, sort of there's pieces here where there's additional people going on SNAP that we're not going through the Medicaid mechanism, although actually our ACA results show a decrease in the number of people who are just on SNAP and not on Medicaid also. So I think that would rule out, at least in the data, in the time period that I'm looking at, that would rule out that kind of effect. That's a great question. Thank you.
Marcy, let's turn to you.
Great, thank you, Lucie. What a terrific talk. This is just fascinating work, and as Jenna said, so clear. My question is about the information part, right? And it's something I haven't really thought that much about before, but how much do we know? It sounds like you're going to be doing a new project on this, but how much do we know about that variation and what happens in these offices? And is that a county level difference, a state level thing? Is that a particular director that's really motivated? Like, how does that actually play out? Because it seems like such a fundamentally easy way to increase participation. And do scholars measure that? And like, do you have a sense of that literature? And like, yeah, that's my question.
No, it's a really great question, Marcy. So I think it's understudied. So we have been presenting this work, you know, for both the two different papers for a while at this point. And one of the comments that we often get is people will have heard about an anecdote having to do with one-stop shopping, right? The idea that some places have sort of a centralized welfare system and that you sort of go in and you get full information about everything you might be eligible for. So we've tried to see if there's any data to be gathered on that, and we have come up dry on that. So I think it's really understudied, but super important, because you're absolutely right. Like, this would be a relatively low cost way, I think, to improve take up. So it's something that, you know, if we had lots of grant dollars, I could imagine trying to collect that kind of information. But I think it's really understudied.
Can I chime in there? Because the Department of Labor, right, the American Job Centers that the Department of Labor runs as part of the Workforce Investment Act program are supposed to be one-stops. They're informally referred to as one-stops. Though it's I think framed more as a one-stop for the person looking for work, then maybe they get some help while they're looking for work, then a one-stop for people who just are looking for help and maybe not so interested in work. But those exist, right? And their locations are known, and over time, like when WIA changed into WIOA, the feds required more things to be there at the one-stop. And I think there's also a casual sense that the one-stops have become more real over time, that sometimes initially the presence of, say, TANF would be a phone, and then over time there's actual people there.
Okay. That's good to know, Jeff. Thank you.
Great. Kelsey, you have a question?
Yeah, so sorry, I had to step away for a second, so I'm sorry if someone asked something similar to this, but I thought Lucie, it was really interesting to see how many different types of data you are using, and this is kind of a two-part question. So for those of us who may be doing like dissertation projects that would follow a similar but like light version of how you've gone through the different steps with your data, I wondered if you'd be willing to talk about the process of figuring out which data you need for each step. And then kind of related to that, I wondered, not for analysis purposes, but I'm just interested if you've thought at all about how much more difficult it would be to estimate ACA effects on things like Title X access, since it's not, it's like a subset of Medicaid users often, but you don't necessarily have enrollment information. So yeah, those are my kind of two pieces. Thank you.
Yeah, those are great questions. I will point out, this has nothing to do with the questions, but it's actually snowing outside of my window. So I'm wondering if this is the same snow you guys all had in Wisconsin yesterday is finally making it to Massachusetts. It's very pretty. So no, those are great questions, Kelsey. So the process of finding the data for this was a little bit drawn out. So we have a grant from Russell Sage for this project that is broad, and it encompasses both the disability paper that we published last year as well as this paper. And as I was saying in response to Jeff's question, with the disability paper, we actually did the whole analysis using SSA reported stocks of disability participants before we decided that that was completely wrong, and then had to get, we were able to get application data from the Social Security Administration. They basically created county level administrative application rates for us. I think we had a sense like, okay, these are the different kinds of things we want to look at. What is available? And it was a sleuthing thing, right? Because it is so many different data. Okay, so we want tax return information. So let's start with the IRS and see if we can find anything there. We know we want food stamp participation rates. So who can I email that I know at the USDA that might be able to direct me to someone who collects these data? So it was a bit of a process, but I think each data set that we use sort of tells a little piece of the story. I think, some of them are not perfect, but I think the combination of the county level data plus the ACS data, as imperfect as it is without the county identifiers, help us, tell sort of more of a story there. The other thing I will just say for people who might be starting out, this county border pair approach it was pretty complicated in terms of the coding, and this is where we completely took advantage of the fact that the AEJ kind of journals require that authors post their code. So Aaron Dubé, who's at UMass, who had done the minimum wage work on this, had beautiful code that he had used to implement the county border pair for the minimum wage, and we completely adapted that for our own analysis. So I just would like to recommend that to grad students, that they take advantage of those resources. I don't know anything about Title X, so I don't have a good answer to that. Can you explain, just tell me like the really short version of what Title X access is?
Sure, and there's other people who are probably better at welfare stuff than me, but I sometimes work with Title X related data because it's, am I doing the right title? I think that's the right title. It's healthcare subsidies for women and children. So they're often funders of family planning facilities. And so I was just thinking about, the unit of funding is to clinics themselves, but the individuals who utilize it, I think are usually Medicaid recipients, or like you do have to qualify for that in some way, but it's much difficult to get that, more difficult to get that granular on like who's using what via which thing. And I just wondered if you had thought at all about what different units of analysis might mean for how you're thinking about your questions.
Yeah, no, I think it's a really great question, and I like I said, I haven't thought much about that. I mean, I think that the whole question of family planning and the extent to which the Affordable Care Act might have had an effect on that, I think it's a relatively open question. So I have worked with Melanie Goldie and Casey Buckles where we're looking at unintended births and the decrease in unintended births in the U.S. over recent years. And the short like Cliff Notes version of that paper is that unintended and intended births track each other really well over most of the past 20 years. except for once we come out of the Great Recession, unintended births continue to decrease and intended births pick up. So one logical question is, well, why is that? Is it better access to birth control through the ACA? And Emily Johnston at the Urban Institute and a co-author have a paper that I discussed at a conference this fall, sort of looking at that. But that's more looking at individual data on fertility. But I think that's a really, really interesting question as well.
Great. Donna, do you want to ask a question?
Good afternoon. Hi. I just wanted to build on the previous conversation, let people know that we actually have a lot of these data available in-house at IRP and the Wisconsin Administrative Data course. We have all the Medicaid administrative data for our state and also the unemployment insurance and a whole range of other data that may be of interest to people who want to ask questions, like the student who just was asking about Title X. And we have collaborators in other states who have similar access to administrative data in their states. So I just wanted to note that. And also, of course, thank Lucie, because this was a really fantastic talk that was, I echo that it was very clear and nicely delivered. So thank you for that.
Thank you.
Jeff, is your hand raised intentionally?
No, sorry. Forgot to take it down last time. But thanks for tenuring our student, by the way, my student.
Okay, any other questions today? If not, then feel free to join me. You can use an icon or you can turn on your camera. Join me in thanking Dr. Schmidt for joining us today and giving an excellent talk. I'm super curious about these findings. These are potentially big and interesting findings. So I'm really glad you pursued this question. We hope we'll have you to Madison before too long. And thank you for joining us.
Thanks so much for having me. It was really fun.
A quick note to everyone, next week, our speaker is coming to us from Melbourne. And so we will be meeting at 3 p.m. instead of our typical DemSum time so that she does not have to get up at 3 a.m. to give our seminar. So a reminder that we have a new time next week to hear Leah Rupener talk about American families and COVID. So we will see you next week. Have a good one.